No one realized what was coming. The pandemic hit us hard. Indeed, it hit all communities like us hard as we pivoted daily, implementing new directives to keep each other and especially our residents safe. Visiting and social activities screeched to a halt. But the first wave was devastating for us. COVID found its way into our community in spite of valiant protective measures. It was so early on that testing wasn't yet available to us. And so before we had the tools we needed to detect and isolate early, COVID had a foothold. What a blessing testing was, and how costly was our wait in receiving it. Sickness, hospitalizations, and death. Residents and staff. In ministry, and our community is all about ministry with older adults. You know there are always going to be risks, but frontline, that was unexpected. I witnessed the pandemic bring out the best in fellow staff as they risked their own health and potentially the health of their families in order to continue to serve. Some insisted on serving in our COVID-positive areas so as to be there for the residents they loved, those who were most sick and isolated. As chaplain, I've always been a single thread in a great web of care of surrounding churches, guest preachers, and volunteers who minister to our residents. Suddenly, I was the only clergy who could physically enter our campus for months during which not even family members could enter, months of unprecedented change, uncertainty, and fear. Our staff were off at a sprinter's pace with the challenge of sustaining that pace for a grueling marathon. At that pace, things become a blur. You lose track of time. My family sacrificed to keep me as safe as possible, supported, and well-fed, which is where the good news comes in, of course. As Isaiah puts it, God gives power to the tired and revives the exhausted. As the people of God have done in the past, we find strength to do the hard things for the good of one another. I have witnessed such generosity, courage, compassion, and creativity from staff, residents, family members, and surrounding churches and volunteers. Love found all kinds of ways to enter our doors. Many hundreds of face masks were sewn and donated to us. Art decorated our campus, and residents were serenaded. As I put together live broadcasts and video content for our in-house channel, I was inundated with letters, videos, and photos to share from surrounding churches. After I could bring clergy in, our district office connected us with volunteers. And then there was the patient perseverance of our residents, who went out of their way to encourage one another and the staff. This wasn't their first show. Those who live long lives have learned endurance. They've developed resilience. And they tend to be wise about choosing to focus on the good that's always there. They remind me of what we can do, what really matters, and the importance of holding each other in prayer. We were giddy when we received our vaccines, and since then we've been able to ease many of our restrictions and resume aspects of our cherished community life. It's an incredible privilege to minister at Wesley Glen Retirement Community, part of the Wesley Communities, which has been serving seniors in Central Ohio for over 50 years. The longer I live and serve and work alongside those who are older than I am, the more it is apparent that life is tough, but it's also a healing journey that draws us ever closer in God's love.